All right, good morning, everyone. Welcome to our Friday morning edition of the Shasta County COVID-19 response. I'm Carrie Schutte, the Public Information Officer, and I would love to start, as we often do, with a rundown on our numbers. We have, as of today, we have 26 confirmed cases, including one from yesterday. We've done 933 total tests to date, including 130 yesterday. We have 8 people in isolation and 42 in quarantine. We've got 13 recovered and we have 3 total deaths. Right now we have 2 people who are hospitalized and 7 total hospitalized throughout this incident as per the numbers from last night. I'd like to introduce our administrative folks and allow them to share anything that they might have to share, and then we'll introduce our hospital folks, and then we're going to have a short presentation from Christy Coleman, our director of Shasta County's Director of Housing, who's going to talk a little bit about some of our housing efforts. And so on the administrative side, we have Matt Pontus, the CEO of Shasta County. We have Donnell Ewert, the Director of the Shasta County Health and Human Services Agency, Sheriff Eric McGreeny from the Shasta County Sheriff's Office, Dr. Karen Ramstrom, she is our Shasta County Health Officer. And then we have Dr. Michael Vivakis, who is our Deputy Health Officer. And I see that Chief Brett Gouveia has joined us as well. He is the Chief of CAL FIRE and the Shasta County Fire Department. Do any of you folks have anything to share in our introduction?
Hi, this is Donnell. I just wanted to address some of the questions I think that have come up about the modeling that we were talking about on Wednesday. Daniel Walker was on making a presentation, and I think just need a few little clarifying points about it. There are a lot of models to try to predict, or maybe predict isn't the right word, but to estimate the number of hospitalizations we're going to have in the future. And this is very important for maintaining proper capacity in our healthcare system. And why this is important is, if our healthcare system gets overwhelmed, not only is that bad for people with COVID-19, if we don't have sufficient equipment or personnel to attend to the very seriously ill, but it's really bad for the whole community because people are getting sick from other things in the meantime. People are still having heart attacks. There are still motor vehicle collisions. There are strokes. There are all kinds of things still going on for people who need some kind of hospital care. So the hospitals need to maintain their capacity for all of us. This is really essential. So the modeling is done as a way to try to use data from the past and using certain assumptions in order to predict estimate what might happen, and so that we can plan appropriately. So the model that we talked about on Wednesday is COVID Act Now is not our model. We did not develop that model. That is a model that's on the internet. They have modeling for all the counties. And in reviewing all the models, we thought it was the best example and most understandable. And it really is conceptual. So I think some people are going on and looking at the specific numbers, which is probably not appropriate, because even today I'm looking at it right now and it says we have 8 hospitalizations yesterday and predicting 17 by the 20th. And we know that we only have 2 people in the hospital right now. So obviously it's not perfect. The numbers are not perfect, and the numbers aren't the point, because every day the numbers are going to change. The point is the 3 basic curves that are on the chart. And so right now we see the one that you can barely see at the bottom is what we're experiencing, a very low rate of hospitalization. The red arc shows what would happen if we did absolutely nothing, and the dark green is showing what we do with laxer social distancing. So it's trying to show what will happen in different scenarios so that we can hopefully plan the most appropriate intervention. I think people are feeling a lot of angst because our incidence is low and they want to see business back to normal. I just think we need to, hopefully the state and the federal government are both taking a moderate approach to that. We definitely don't want to remain as we are now, but we are not probably going to be returning to the way things were in January of 2020. So I think people need to brace for an intermediate type of scenario where there is a relaxing of some of the social distancing measures, but a maintenance of others, so that we can try to stay under that line, that dotted line in the model, which shows our capacity, which is pretty accurate. We have about 500 hospital beds available. We do have some extra capacity with our federal medical station, but we do not want to get, to the place where our hospitals are all jammed up. I also wanted to say, we do have small numbers, and our small numbers do make for lack of precision in many of the estimates, meaning that there's a big plus or minus or confidence interval. And that's what those big colors are for. We don't know that it's going to look exactly like that. There's a big range around the estimate. And we know about that from like political campaign polls, where they'll do polls and they'll say, so-and-so's got 44% of the support plus or minus 5%. That's a confidence interval. And these also have giant confidence intervals around them because we're a small county and there's small numbers. So that's another thing to keep in mind when looking at the model. And I'd be happy to take any questions later.
Thank you, Donnell. Do any of our other administrators have questions before we go to the hospital folks?
Not questions, but I did want to just kind of follow on to what Donnell is saying. I think it's really important to recognize that those models help us plan for the healthcare delivery system impact. And it really helps us to see the influence of all of the social distancing steps that people are taking in the community. And so, we're seeing our numbers leveling off. We hope that continues. And we all are interested in moving towards some level of normalcy in our daily lives. And so I think we're going to continue to watch that. Right now, it's not all up to us. We do still have the statewide governor's stay-at-home order. And as that evolves, we are having discussions locally and planning for what that will look like as aspects of the state order are loosened. We're thinking about how to go about this in a gradual, stage safe manner that will allow us to continue to protect our most vulnerable groups and not overwhelm our health system, but at the same time start to lift some of the restrictions on our movement so that we can actually begin to interact more and have some low level, slowly staged lifting of what we're doing now. And so we look forward to that and hope to have some information to share soon with the community to start that discussion.
Thank you, Dr. Ramstrom. Anybody else? Okay, anybody else from administration? Seeing no green lights, so we'll move on to our hospital partners. We have Robert Folden from Mercy Medical Center. We have Jessica Candaby from Shasta Regional Medical Center, and we have Valerie Lakey from Mayor's Memorial Hospital District. I don't think I missed anybody. Looks like no. Do any of you of our hospital partners have anything new to share with us this morning? Okay, seeing no green lights. I would now love to introduce Christy Coleman. She's our director, Shasta County Director of Housing, and she has some new information to share with all of us today.
Hi, good morning. Thank you. Good morning. So I wanted to share today with what the Housing and Community Action Agency is doing to house the vulnerable populations during this time. The Housing and Community Action Agency is working with the local hotel to shelter the vulnerable population during the COVID-19 pandemic. The vulnerable populations are individuals who need isolation or quarantine, as documented by a medical health professional, state or local public health professional, and individuals who are asymptomatic but are at high risk, such as those that are over 65, and those who have underlying health conditions such as respiratory, compromised immunities, chronic disease, and those conditions do have to be documented by a medical health professional within the last 60 days. They have to require non-congregate sheltering as a social distancing measure. The Housing and Community Action Agency is actively utilizing our local HMIS system and working with local service providers and case managers who are working with the vulnerable population that needs shelter during the pandemic. The case managers will continue to provide case management services to the individuals while they are sheltered. And the Housing and Community Action Agency is working with local agencies to coordinate services provided to clients while they remain in shelter.
Okay, thank you very much, Christy, for that update. I think we are ready for media questions.
Well,
Who
top
wants
of the
to-
morning to everybody. Although I'll say that Matt and Val are on the bottom because they're still upside down on my screen. I wanted to, of course, follow up on what both Donnell and Dr. Ramstrom said. With the addition of, as Donnell said, there are several different models out there, and we just got something about an hour ago from Butte County's health officer, Andy Miller, who was talking about a model from Johns Hopkins that shows 76 deaths in Butte County on or by June 1st. Is there anything similar for Shasta County, or again, are we just looking at numbers that people are throwing darts at right now because of the small numbers that we have?
Donnell, I think, it kind of depends. It depends on where we go from here. If we maintained what we're doing now, which I don't think is going to happen through May, but if we did that, I do not think we would have a large number of deaths. I think we would have a very small number of additional deaths because, our incidence right now is very low. We probably have very limited transmission happening because stay-at-home orders been so effective. But if the scenario were to change and the social distancing measures were altered by the governor, then the situation could change and there could be a higher incidence of disease, more hospitalizations, and more deaths. So it's really impossible to say until we know a little bit more where we're headed and in what time frame.
Is there a similar estimate for Shasta County from Johns Hopkins, or are we aware of that?
Yeah, Mike, I think Dr. Miller's referring to some modeling that the state did, and they provided county level data. I'm trying to look to see what are comparable. Was he giving ICU or hospitalization?
I believe all that was in there, but the number that jumped out was that 76 deaths by June 1st. And you're right, it was a state study.
Yeah, we don't have the death data. We have hospitalizations and ICU occupancy. But we can follow up with him. I'm sure it's the same source, but I have not seen the death data.
What do you have for Shasta County from that study? Can you share that?
Well, it's hard, and I'm curious what he even pulled out because they, like Donnell explained earlier, the numbers are small right now, so the confidence intervals are quite large. If you look at the range of numbers that they provide, one of the things I think that was most helpful with that data is that the state overall, that it looks like we're tracking, if you look at actual numbers, we're tracking close to the median. And so the median seems to be the better estimate right now for the data that the state provided, that particular model that they used. And the data that they provide us was hospital occupancy and ICU occupancy. So I'm assuming that's where he got his information, but I haven't seen the death data.
Okay, thank you. While I have you there, I'll just ask you one more thing and then I'll be quiet. You said you were going to share some perhaps changes to the way we're doing things now soon. Do we know how soon that will happen?
Well, it's a good question. We're starting to have those planning conversations now, but we can't really do anything until the governor takes action at the state level. And I imagine that also is going to be in a stepwise manner. And but we're having those conversations so that we can make sure that we're prepared locally when the governor does that, because he may actually then defer to some of those decisions at the local level. And so we want to have discussions in advance of that occurring at the state level. So it would be things, so thinking about, could we perhaps allow small groups to begin gathering, but continuing to encourage older adults and people with underlying health conditions to stay home, for example. And as we lift any of those aspects of the stay-at-home order, we would be monitoring our data very closely and making sure that we're doing, continuing to do intensive case investigation, contact tracing, isolation, and quarantine, and communicating closely with our hospital partners to make sure that their numbers are not going up. So that's one example. I think there's a general feeling that that the last thing we will do is really free up for general movement, older adults, people with health conditions, and measures that are taken in congregate settings right now. We're going to want to continue those until we have community level protection. So our skilled nursing facilities, for example, other congregate settings, they're going to want to continue to limit visitation, making sure healthcare workers are not having fevers or symptoms when they come to work, that kind of a thing. And so, yeah, there's many aspects to it, but that's the overall concept. And again, we'll have to see how the governor goes about it, but we want to make sure we're having those discussions and having some of that decision making from a planning perspective in advance, so we can be ready.
Thank you, Doctor.
Good morning. This is Karen Alvarez with Action News Now. Yes, my series of questions pertain specifically just to the federal medical station. We know that the county is looking to hire healthcare medical professionals. Do we know an exact number of positions that need to be filled?
I do not know the exact number of positions. Maybe Karen Ramstrom does. But it's a significant number because there are 3 shifts required, and it would depend on how many patients were there as well. We don't necessarily need to be using the full capacity of 125 beds, especially at the beginning. It could be a much smaller number, and then it would be a smaller number of employees. But it is a significant number of people, and efforts are underway to recruit. We do have some people who have submitted applications. But I don't have the exact numbers.
What kind of positions specifically are you looking for, or if specific positions in particular?
So what I can share is, I mean, they definitely took initial steps to actually have sort of their leadership structure in place. So they have chief medical officer, chief nursing officer, those kinds of positions. And then they're going to want to make sure that they have physicians, nursing staff, pharmacy staff, and other supports, people who can help with case management, planning for, discharging, that kind of a thing. So similar to what you would have in a hospital setting, but not for the other types of ancillary services that you would have in a hospital. So it's pretty general staffing, and then additional, support staff that they would need for, that would be non-healthcare professionals as well, just for the infrastructure support.
And as of today, so my last question, as of today, are there any patients right now at the federal medical station or currently being treated as of today?
No.
Thank you.
Yeah, I had a question about the modeling. Are there an adequate number of test kits now that it would be possible to actually take a random sample of the population so that that could be projected into a really accurate window of just how many people are infected, and thereby maybe narrow that confidence gap or margin of error on the charts? Is that possible? Are there enough tests to do a random sample?
So the type of testing that you're referring to is not the diagnostic type of testing that we have available right now. The type of testing that we're doing more broadly right now is actually tests for the nucleic acid from the virus of somebody who actually has symptoms. So they have virus in their nasopharyngeal tract. And so, but the kind of testing that you're talking about is more like an antibody type of testing. And that type of testing is evolving. I know that the CDC is currently doing some research in areas of the country that are more heavily impacted by COVID-19. And the reason my understanding is that they're doing that is because we want to learn about how that test plays out in a community where you actually have disease transmission, because there are other types of COVID viruses. And so you want to make sure that you're using that particular test in a population where you do know that you've had some disease transmission. And so that research is ongoing. There are other FDA, EUA approved tests. There is concern about the quality of those tests, depending on what population you're using them in. And so at this stage, it wouldn't be appropriate to use them. It wouldn't be helpful information for our particular situation here in Shasta County, but we're hoping that more of that information will come along soon so that we'll better understand how we can actually use serologic testing in our response. And we're thinking about it just exactly as you described. We're not quite there yet for all of the reasons I just outlined, but we're definitely paying attention to it.
This is
Other
Donnell too. I'd
questions?
like to add that we have real hospitalization data available, and our hospitalizations peaked on April 5th, at least in this initial cluster. And they've been in decline ever since. So, you know, we have a pretty good sense of what's happening here. And I should also add that our positivity rate of total tests has gone down over time. I think we're under 3% now. So while we can't do the kind of testing you're suggesting, we have other tools we can use to try to, you know, get some kind of guesstimate about what kind of transmission there is in the community. Based on the indicators that we monitor, we do think it's fairly low at this time.
Just one follow-up, because as of now, the testing is limited to people with acute symptoms and people with known exposure. Are we still basically getting a window of 2 weeks ago?
It's a good point. And so, you know, even so, talking with our healthcare providers in the outpatient setting, it doesn't seem that we're seeing as much respiratory illness. Anecdotally, talking to many of our main outpatient facilities, I think the emergency departments may still be seeing a good amount, but that's part of it too. But you're right. So there is that 14-day window that you can actually see cases come up after exposure to an infectious person.
I have a question, Mike Chapman from the Record Search site for Dr. Ramstrom. A while back, you stated that that church on Airport Road was at higher risk because of the 6 positive cases. Can you say whether the Reading Veterans Home is also at higher risk?
So anytime we have any connection of a case or a contact, even, you know, before or after the period of where we would think there'd be transmission at that facility, we're paying close attention to those because we want to make sure that we're keeping a handle on those kinds of facilities where disease can transmit very, very quickly. And so we have shared, I think, that the Veterans Home is a place where there have been people who have been associated with that facility and either been a contact or a case or an employee, for example. And so we're definitely paying attention to that and continuing to monitor for additional cases. And there's other strategies that we're looking at, and that the medical director there, we're in close communication with them. They're doing a great job. I have to say that they have really taken this very seriously and are implementing really rigorous prevention measures. And so all of our skilled nursing facilities are going to continue to keep a close eye on if there's any inkling of any kind of disease transmission or contacts with those facilities.
Yeah. Can you say how many positive cases there are at the veterans home?
So we have looked at that so extensively, I can't even tell you right now, because we're trying to identify any potential link. And so we, my understanding is right now we have one individual who is still in isolation, a resident who's still in isolation at the veterans home.
All right, thanks.
Other questions? Okay, and 3, 2, 1. Here.
For Christy.
Oh, sure. Go ahead.
What did you say? How many? Now for the housing situation, you're doing so that help for the homeless.
Give Christy a second to unmute herself. There
Can
she
you hear me?
is. Yes.
Okay. It's for the vulnerable population during this time.
Okay.
All right. Any other questions before we part ways for a weekend? Okay, hearing none. Thank you all very much again. We appreciate our folks in the media for helping us to keep the public informed. Thanks to all of our experts for being here to answer questions from our reporters, and we will be back on Monday morning at 11 a.m. Everyone enjoy a safe and healthy weekend.